I would like you to think of your favorite activity, celebration, or trip. Any moment that brought joy. Can you picture it? This is my favorite moment. This is northern Norway above Arctic Circle in early July. During July, sun doesn't set. And there's a small fishing village called Ryan. And outside of this village, there is this hike called Rheinbergen. It's only zero point 0.6 miles in distance, but I had to climb up 1,500 feet, hiking up almost 2,000 stone steps. So I started this hike around 10:30 p.m. and reached the top around midnight. Now look at that pure beauty. Now imagine if I had a progressive eye disease that over time caused me to lose my sight. The beautiful image of Rhine will be less focused for me, and I would see this. And as the disease progresses, I will not be able to see the details, and the image will become less and less focused. And I could also reach a point where it'll be hard for me to identify this image. And finally, if I lose my sight, it'll be a darkness. The human eye is a powerhouse. From the moment we wake up, from the time that we go to bed, our eyes work tireless to provide us with the visual information. If the human eye were a digital camera, it would have an estimated resolution of 576 megapixels. Our eyes can capture the details and perceive the world around us with a stunning clarity. Unfortunately, for those who have age-related macular degenerations, or AMD, the details, the clarity, are something they progressively lose with the disease progression. Now, let's look at what the inside of your eye looks like. This is a fundus photograph showing the inside, the back surface of a healthy eye. The back of the eye is aligned with the retina, which is a light-sensitive neural tissue that captures light, converts it into electrical signals that send to the brain, and where it can be deciphered as images. A small oval-shaped area in the retina is called macula, and this is where our central vision starts. It's responsible for us to see the details and color. And you'll also see the blood vessels that bring nutrients and oxygen to the retina. Now, with a healthy macula and retina, you will be able to see these Galapagos blue-footed boobies and their colorful and whimsical treats. In fact, those blue feet are so important, their mating dance and finding the right partner. Now, what does a fundus AMD patient with a vision loss look like? They look very different from the normal fundus photo, right? Some blood vessels are disorganized. In fact, they're abnormal blood vessel growth. And these blood vessels are leaky, meaning blood and fluid leaks into the retina. So combination of abnormal growth and leaky blood vessels eventually damages the macula and distorts central vision. This type of AMD is called wet or neovascular AMD. Now, what about those cute, colorful, blue-footed boobies? Well, this is what the wet AMD patients will see. They will not be able to see the details of their faces or appreciate the blue feet. With the increasing aging population, AMD affects 1 in 8 people 60 years or older. It is the most common cause of blindness in developed countries. It has been estimated that 200 million people worldwide have AMD, and is projected to be close to 300 million by the year 2040. AMD is a complex disease, and there is no cure. Recent survey reported that individuals prefer 4.6 years of life in perfect health over 10 years of life with a complete vision loss. Many fear loss of sight more than losing memory, speech, hearing, or even have a heart attack or stroke. And as I said, there's no cure for AMD. So what are the treatment options to combat this disease? Well, in the early days, options were limited. Retinal specialists tried thermal laser treatment and photodynamic therapy with minimal success. And many AMD patients were losing their sight. No more reading their favorite books or ability to drive. Loss of sight leads to loss of independence, social isolation, depression, decrease in quality of life. So what can science tell us about AMD and the possible discovery of a treatment? Since the 1940s, scientists have suspected that there is a mystery molecule, and they call it factor X. And they believe that factor X plays an important role in regulating blood vessel growth and permeability. But what was it? Not until 1980s, we identified the factor X to be vascular endothelial growth factor, or VEGF. VEGF is a signaling protein that promotes new blood vessel growth and maintain blood vessel integrity. And we need VEGF. It is essential for our normal physiological processes. However, when the normal physiological balance is disturbed due to factors such as hypoxia, inflammations, and others, the VEGF level increases. So indeed, the studies have shown that the VEGF level is increased in AMD patients' eyes. With this new knowledge, a series of studies led to the development of anti-VEGF therapy. As the name suggests, anti-VEGF targets and inhibits VEGF level. The therapy restores the integrity of blood vessels and fights the leakiness of blood vessels. Landmark studies have demonstrated that anti-VEGF therapy is successful. Not only did the therapy slow the progression of vision loss, but for the first time, AMD patients gained sight back. With active anti-VEGF therapy, about 50% of patients were able to maintain visual acuity of 20/40, meaning they were able to read, drive, and carry on with their daily activities. And the application of anti-VEGF therapy went beyond AMD. Other retinal vascular diseases, such as diabetic retinopathy, retinopathy of prematurity, and vein occlusion, all benefited from the anti-VEGF therapy. It is not a cure, but anti-VEGF therapy is considered one of the major advancements in ophthalmology. So what's the catch? In order for therapy to work, a patient needs to get a direct injection into the eye with a needle. Not just once, but every 4 to 6 weeks for 2 years or longer. In fact, we have patients who have received regular injections for over 17 years. This is a significant treatment burden, a burden on the patients and their families, on our physicians, and on our healthcare system. So how do we solve this treatment burden problem? Well, I've been working closely with a team of scientists, engineers, and clinicians to solve this. But first, you might ask, why do we need repeated injection of anti-VEGF? Well, AMD is a chronic disease, and anti-VEGF is not a cure. We need repeated injections since anti-VEGF drugs have a short half-life in the eye, meaning the drug effects only last for several days. Another reason is that inside of the eye is a dynamic where they constantly clears the drug. And finally, it is challenging to maintain anti-VEGF biologics for a long time. So our solution is to use sustained release drug delivery system to maintain a relatively constant anti-VEGF level in the eye. We developed a biodegradable microsphere hydrogel composite system to deliver anti-VEGF. The drug is loaded into biodegradable microspheres, and which then is added to the hydrogel. And our system is made out of highly biocompatible polymers. Some of the advantages of our systems are, well, first, we invented a procedure to protect and keep the drug stable for longer time. Second, it is injectable such that the same injection procedure can be used and no new procedure has to be adapted by the physicians. And finally, a single injection can last for over 6 months. Over the years, we have performed extensive in vitro characterization of our drug delivery system. We have tested our system in small animal models, and recently, we published a long-term safety data in large primate model. We have demonstrated that our drug delivery system is safe and effective. So based on our promising data, we are excited that our technology can have a positive impact on anti-VEGF therapy. We envision that with our extended drug delivery system, patients will need injections every 6 to 7 months, significantly reducing the return visit to the doctor's office. As a result, we would decrease the treatment burden and increase the quality of life for our patients. Instead of limiting activities due to many doctor's appointments, they can be fully back in life. Until we find a permanent cure for AMD or other retinal vascular diseases, anti-VEGF therapy remains the gold standard and only treatment. And our goal is to reduce the treatment burden of anti-VEGF therapy with our drug delivery system. Our work is not done. We must continue to research, discover, and innovate to advance technology so that monthly injection will soon be a thing of the past. After all, we all want our patients to be able to travel to the Galapagos and enjoy seeing these cute and silly blue-footed boobies, or visit northern Norway to enjoy the midnight sun. We want to increase the quality of life by saving eyesight one injection at a time. Thank you.